I want to ask you that when you are using contrast, because I was talking to some Japanese operators and watching them also, they tend to use contrast through the microcatheter, small amounts of dye, which I sometimes am a little worried about. Do you tend to do that as a technique, inject dye through the microcatheter to look at where you are? Besides, of course, having the contralateral approach, you have a contralateral injection as well. So can you give us some idea about the contralateral as well as injection through the microcatheter?
Very, very important. So I actually personally had never done the injection through the microcatheter.
Right.
I know people do it, but at the same time I have seen so many bad cases where the microcatheter was little underneath the plaque and they gave the dye and the whole thing dissected. Second, what I would do is the contralateral, when you use a smaller catheter so that you get less dye. So 4 French.
Right.
So my usual contralateral, unless we are thinking about retrograde, which you can always upgrade.
You can upgrade.
It's a 4 French contralateral.
So you don't give too much dye from there.
Yeah, that's how you save the dye.
Okay, so you save the dye. Do you tend to dilute the dye or anything of that sort? Do you have some kind of technique like that? Do you, because we do that sometimes in our lab.
I see.
We've been doing that, and not for the contralateral, but for the antegrade kind of approach. So we dilute the dye because you don't need the full contrast of the dye all the time. So that way we save some of the dye in these kind of situations.
That's a very good point. That was one of the point I made, that to decrease the overall contrast volume, I would say use it in a small percentage, where the creatinine is a major issue. Patient's serum creatinine is 1.8, 2.2 in that situation. But yes, that's another good tool, very useful tool to decrease the overall contrast volume.